Hi there, good afternoon. My name's Dr. Corey Regnerus. Thanks so much for taking a moment out of your busy day in order to join me for a very short kind of tutorial on critical care nutrition and our fantastic new innovative product called Recovery Liquid that you're hopefully seeing in clinics now. Once again, I just wanted to thank you for joining us, and hopefully, you found the EDM that has come out to you guys of value with some more interest on the product and just raise some of the awareness. But the applications and implications of the diet are important to cover as well. So let's go ahead and get started. Really important, I'd like for you to reflect on who's actually creating nutritional plans for every hospitalized patient while they're in your care. These patients are coming to us to be looked after and cared for, and we do look after their medical conditions with high priority. However, we don't necessarily focus on the nutritional aspect. Do remember now, too, that the WASAVA guidelines now include the nutritional status as part of the vital signs for pets. So that's pulse, respiration, and temperature, as well as pain and now nutritional status as well. So interestingly, there was a few studies done, but one that brings and really highlights the point here, where there was one done with 467 dogs and 55 cats. Of the animals that were hospitalized, which ones were most likely to be discharged? Was it those with a voluntary food intake, those that we supported with enteral nutrition, or those who didn't have any food intake at all? Hopefully, it's no super mystery to you, but the ones that had that voluntary food intake are the ones that had the most likely chance of being discharged. So, getting these guys eating on their own before they go home is super important for the recovery process. If we break this down into the information from the study that was there, those that had voluntary intake, so those that were eating on their own, 93% of those were discharged from hospital. That compared to only 72% with those that we were supplement feeding with enteral support. However, the concern is that those that don't eat at all, whether that was because they didn't want to eat, they couldn't eat, or that we weren't feeding them because there weren't nutritional plans developed for them, only 39% of those were discharged from hospital. So, why is nutrition important to consider for our hospitalized patients? We know that nutrition is important for day-to-day body maintenance, but it's also really important for that maintaining of strength, immune function, and wound healing that most of these guys are dealing with in that critical case scenario. There are studies that have demonstrated both in pets and in people that it improves the morbidity and mortality rates and provides essential energy to the enterocytes in order to maintain the gut barrier function and other GI functions. In order to protect that gut, we need to feed it. If it's working, we need to use it. So, more stark statistics for you on some of the concerns around how much malnutrition might actually be occurring in the veterinary practices across the globe. There was another study that was done in 2001 that looked at the nutritional status and recommendations based on RER for those patients. And how common do you think that malnutrition was in hospitalized dogs in this study? Concerningly, 73% were not eating adequate RER each day. And of those that that were eating less than 25% of the RER, sorry, I'll just rephrase that. Do you know how many of those that weren't getting their 100% RER? There was a strong proportion of them that were getting less than 25% of their daily resting energy requirements, that RER, and that was 84%. So of those that weren't getting enough nutrition, majority of them are getting far too little nutrition. So when do we need to consider intervening, and when is it that we really need to start focusing on these resting energy requirements, calculating them out, developing feeding plans, and setting a process in place to look after these animals? The 3-day rule is a really good one. So any animal that has been undernourished, including malnourishment and just not eating enough, so not full RER, for 3 days or more needs to be taken into consideration. So if they're eating less than 80% of their RER for 3 days, they're at low risk. Whereas if they're eating less than 80% of RER for 3 to 5 days, then they're at a moderate risk, and greater than 5 days, they're at a high risk. If they're not eating at all, again, that 3-day rule comes into play, and they're absolutely at high risk. So, two or more of these high risk factors that are presented on the chart on the screen is when we should be considering intervening with assisted feeding. So, this is either really encouraging them to eat by hand or by placing feeding tubes. Those with less than 2 high risk factors should be monitored, and daily reassessment should take place in order that they don't to make sure they don't flick into these high risk categories. We do need to make sure that we offer food and encourage that spontaneous consumption as soon as possible, because remember, those that are eating on their own are the ones that are most likely to be discharged from the hospital. If we look at a few more studies, and this is where those first statistics were coming from, so 64% of animals that showed voluntary food intake during this study, and again, of those, about 93% were discharged. 19% of those patients hospitalized were receiving enteral support, and 71% of those were discharged. 6% were receiving parenteral support, and of which about 62% of those were discharged. But unfortunately, we don't really have that as an option here in New Zealand. And then 4% didn't receive any calories at all. They just were not eating. And that's where we get those stark statistics, around 38% that were discharged. In addition, another study looking at 300 dogs showed that dogs that were consuming more than 95% of their RER, 97.6% were discharged. As soon as they eat less than 95% of their RER, only 85% of those were discharged. So it is really important that we're doing those resting energy rate requirements, and we can use that as a baseline to make sure that these guys are getting appropriate nutrition to help them recover and get them discharged from hospital. So if we're thinking about assisted feeding, what types of measurements and concerns do we need to be aware of? So body weight, and that needs to be done daily. So daily body weight measurements are really important, especially for those that are on intravenous fluid therapy. We want to make sure that we're monitoring the body weight for overall body function. Body condition score is part of that, especially for your long-standing patients, and more importantly is muscle condition score. So we know that ill patients and those that have chronic illness, they will start to lose muscle mass before they lose body condition score when they are in the state of malnourishment. So for our hospitalized patients that are sick and trying to recover, they're more likely to lose muscle condition score before they lose body condition score. So make sure that you do check out those statistics and great guidance on how to do muscle condition scoring, as well as some charts that you can put up around the clinic on the WASAVA website. A complete diet history before you get started is really important to make sure that we're not running into any other risk factors. Take into consideration any of the medical conditions that you've now diagnosed with those, and also any medications that they might receiving. This is more important for how it's being delivered, because they can develop adverse food reactions if we're hiding food in medication. So best practice is to never hide medication in food, and only provide it to them outside of that normal feeding regime. Ideally, if they're on a tube feeding, you would feed it through the tube, and keep that tube potentially in longer, even once they are eating, in order to continue to give them the medications that they might need and to try to keep them from getting adverse food aversions. Syringe feeding, we just need to avoid it at all possible. It's the time that we really just need to move on from that practice. It's not good for them. It's associated with high levels of stress. And again, it really is encouraging that food aversion, especially in cats. Feeding tubes, so consider proactive placement if it's indicated. One of the other things to take into consideration when you're talking about when do we intervene is not only how long have they been underfed or have they been not eating in the hospital, but how long has this been going on before they've arrived. So if they're already in that moderate risk category for potentially needing assisted feeding in the near future, while they're stable, it might be a really good idea to place a feeding tube proactively. Parenteral nutrition is really advised only for that times that you have intractable vomiting, severe malabsorption issues where there's marked degradation of that gastrointestinal tract, or potentially neurological disorders as well, where gag reflexes and other things might be dampened and be at a risk. And this is why we're talking to you guys today. So tube feeding has always been a bit of a scary one. Nobody really wants to do it because it's so painful to be able to manage these patients in hospital, between trying to blenderize food and get it thin enough without any chunks and stop tubes from blocking. And this is where the new recovery liquid diet is ideal. So this is a complete and balanced nutritional solution for our critical patients. It's completely liquid, and syringeable. And as you can see on the side of the screen there, it's got a fantastic cap that has two different basically charge ports in them, one for your smaller lure slip syringes and one for your larger catheter tip syringes. So depending on what tube sizes you have available and the volumes of food that you need to be feeding. It's high in protein in order to help maintain that muscle mass, which we've already spoken about is a priority to focus on, as ill patients are going to lose muscle mass before they lose body condition score. It's high in energy in order to try to offset the volumes that need to be fed. So it is 1 kcal per mil, which also makes calculations really easy. An antioxidant complex, which we know is really important for that recovery process, as well as making sure that we're looking after the gastrointestinal tract. And we've already mentioned that it's an easy tube feeding formula and completely liquid. So here I've done a bit of a demonstration with you with the product using a 6 French tube. So the liquid recovery diet is suitable for those in less than 10 French, which makes it really ideal for nasogastric feeding. That's the type of tubes that we'd be using in short-term feeding solutions, not in long-term feeding solutions. And it just makes it a little bit easier as we don't require a general anesthetic for that as well. As you'll see here in the video, when you get the bottles, you open them up and there's a tinfoil cap. All you need to do is just slightly invert it in order to mix it. It's got a very fantastic homogenized consistency about it, and that's part of the unique technology behind the recovery liquid. As you can see, it really just looks like up and go, and then we can put that innovative cap back on the top with those charge ports. And as easy as that, you've got the two different sizes for your lure slip and your catheter tip, and all you need to do is plug it in and suck it back, and away you go. It's made with a rubber cap, and it's got folds in it as well so that it doesn't leak afterwards. So if it happens to get knocked over, you're not going to lose it all over the countertop. And then we can see here that once you've got everything going, you can prime your tube and get it set. And like I said, it looks a lot like and feels a lot like up and go in the syringe. And you can see how easy that passes down the tube. So now that that tube is primed, we can go ahead and do the full feed. So in this case, let's say the patient only needs another 5 mils for this feed. Once again, plug it back into the cap, and easy to use, easy to go. Plug it back in, and once again, you can see just how easy and little resistance there is in order to squeeze that through a 6 French tube. Flush it with some warm water behind that, and you don't have to worry about it blocking. It's just that easy. So when might we be using, oh, this was an 8 French, sorry, not a 6 French. And when might we be using this product? So really in that convalescence or that recovery phase, in opportunities where there's been malnutrition or refeeding after anorexia, post-surgery and intensive care, acute and chronic diarrhea, especially for those that were worried about becoming dehydrated, and hepatic lipidosis in cats as well. And that's part of the high energy requirement. Because of that high energy, however, in this diet with that 1 kcal per mil, it's not recommended for use in pancreatitis patients. So we cannot be using that when we've got those patients that just won't eat. Unfortunately, we need to be looking at something like an esophageal tube and blending the Royal Canin GI low-fat diet in order to get the calories that they need. Hepatic encephalopathy as well is contraindication for using this due to that high protein, and it's not balanced for growth, gestation, or lactation. Some tips for using it in the clinic. So refrigerate after opening, and it's good for 48 hours if it's kept in the fridge once open. The bottles are 200 ml bottles, so they are quite small, but it does make it easier to make sure that you don't have a large volume that's going off. And again, store that in the refrigerator and discard within 48 hours. If you're going to be using it throughout the day, the best practice is to try to keep it at room temperature or at body temperature when feeding. It just stops some of the discomfort with the cold liquid going into the abdomen and might encourage things like regurgitation. You can use a warm water bath or even the baby bottle baths for those, or again, just leave it out if it's going to be used throughout the day. Swirl it to rehomogenize it before using. Again, you just need that very gentle rocking motion. Don't shake it because it will foam, and that makes it a little bit harder to get accurate volumes for feeding. And do make sure that you flush the tube both before and after use. It helps to stop any of that sticking. But again, the great thing with this liquid diet is that it doesn't clog and block the tubes. You should only be using about 5 to 10 mils of room temperature in order to wash those tubes, no matter the size. And if you have a large tube, don't forget that that recovery mousse is also available. You might have seen in the reset that took place this last year that we have updated the formula. It's had egg removed in order to make it a little bit easier for importation requirements, and they've improved the consistency into this new ultra soft mousse texture, which makes it even easier to syringe. Again, we would still only recommend using the recovery mousse in greater than 10 French gauge. Unless you did want to, you could always dilute it with water still. And the recommendation for calorie corrections, just so that you can figure out exactly how much you're putting in, is 1-to-1 dilution tends to give you a pretty good liquid feed. We can use it for all the same reasons that we might be using that recovery liquid diet for. However, the added benefit of this product is that it is balanced for growth. So if you do have patients, young patients, parvo patients, if you can get feeding tubes into these guys early and provide them with the recovery mousse via the esophageal feeding tube, that's going to be your best bet for that long-term recovery. Still, again, not recommended for use in pancreatitis or history of pancreatitis in our canine patients, or the hepatic encephalopathy due to the protein levels, and it also isn't balanced for gestation or lactation. However, it can be used in very short periods of time. So there's plenty of products available for you guys. All of these resources are available, and we've got individual feeding guides, product book pages for both the recovery liquid and the recovery mousse diet. So the recovery liquid is 80% moisture in that liquid form, and the mousse is 73% moisture. We have all the comparisons there for you if you were interested in looking at on a per 100 mil as fed to compare those diets across the board. But the great thing is that that recovery diet is jam-packed with all the nutrients, the protein, and the energy that they need in small volumes, despite it being a liquid diet. As I mentioned before, all of these are available on the vet portal for download. And if you haven't been on there, I do encourage you to jump on. I always encourage everybody in the practice to have their own vet portal account. You can have as many vet portal accounts per clinic as you like. You just need to register your name and your email address and which clinic you're employed with to link it through to the system. Then that way you've got your own login. You don't have to worry about chasing down a clinic password. And you can also access all of the additional products and services like the webinars and the podcasts that we have available too. You can easily get to the vet portal by just going over to our main website, royalcanin.com/NZ. And then in the top right-hand corner, you'll see the little icon of a person. And in that drop-down menu, you've got the vet portal where you can log in. In addition, for some of the products and support that we have for the recovery diet and critical feeding, there are guidelines for critical care feeding in there, as well as step-by-step instructions for nasogastric and esophageal tube placements in cats and dogs. There's also all of those product book details that we previously spoke about. So now that you're excited and you're going to use this new recovery liquid diet, you do want to make sure that you've got monitoring when you've got those nutritional plans for your patients in hospital. Ensure that the feeding volumes and the calorie density of the diet is used, and that's being recorded in the patient file. And that should be reflected back to the resting energy requirement calculations that are done for your patients. Make sure to monitor the food intake and body weight daily, and don't forget to monitor fluid volumes as well. This is really important for those that are on IV fluid therapy, as we don't want to run into issues of fluid overload. As an example of that, this is a plan that I had put together with a patient I was managing when I was in practice. And this patient here, we had placed a feeding tube and we did a staged recovery for feeding because he had been anorexic for more than 5 days. So we did staged recovery where the first day we did 25% of the RER, the second day we did 50, then 75, and 100% by the fourth day. And what you can see that we've captured in here is that 25% of the RER, it was going to require 18 mils of the feeding, as well as the 5 mil flush. And with that, at 25%, the patient was receiving 80 mils of water per day. And we can take that out of the daily calculations for the water requirements for that patient. At 50%, the patient was receiving 140 mils per day. So just remember to check your calculations at 60 mils per kilo per patient per day for maintenance, plus any of the fluid deficits that we're not overloading these patients with a liquid diet. And what about ongoing monitoring? So once they're discharged, you want to continue to monitor them for 1 to 2 weeks because we know that these guys give us a false sense of security where they go home, they're eating like champions, and then about 3, 4 days in, they go anorexic again. So we really want to make sure that we're monitoring that they're eating well, that their body weight is maintaining, and their body condition score isn't losing, and potentially even gaining back some of that muscle condition score that they might have lost. You will need to adjust the feeding to achieve that and maintain that ideal body weight and condition in that home environment so that we're not overloading them. And again, we don't want them to gain weight too quick. We just want to make sure that they're getting some of that condition back. And when do we discontinue that assisted feeding? And more importantly, when do we look at pulling the tube feeding? So when the animal's eating 60 to 75% of its RER orally on its own, then you can discontinue that enteral feeding support. Decrease that slowly over about a 12 to 24-hour period, but leave the tube in place. Because again, sometimes these guys give us a false sense of security where they are eating, and they seem that they're going to be doing well. And then for whatever reason, maybe they get a bit nauseous and they go off their food and we're back to square one. So that 60 to 75% of the RER is what they're consuming on their own. So we need to make sure that the calories of whatever diet they're eating themselves is also captured with that tube feeding. Unless the tube is pulled sooner, that they should be eating their full RER by themselves before you pull that tube, as well as maintaining their body weight for a week. So this is a nice way to make sure that you can also send patients home with the tube still in place and send them home with the maintenance equipment that they might need, including flushing that tube once a day to make sure that it stays patent, but leave it in place because again, we don't want them to have that false sense of security where they relapse and we need to see them again. So that was a really quick summary, and I hope that there's been some value in that. And the topic of critical care nutrition is huge, but hopefully this has given you a good insight into that. Not only that, but it might give you the confidence to now consider trying tube feeding in your patients in the hospital, but more importantly, setting up a hospital feeding plan for their hospitalization and their recovery. We have that new recovery liquid product that's now available from all of your wholesalers, as well as that recovery mousse and that updated texture that should be flowing through now as well. If you have any other questions or you'd like to get in touch for more training, please do reach out to your Royal Canin representative, or you can get in touch with our consumer care team on 0800 992 001. Once again, my name was Dr. Corey Regnerus, one of the veterinarians here in New Zealand with Royal Canin. If you have any other questions, please feel free to get in touch, and we hope that you stay well.